Okay, thank you very much. Thank you very much to invite me. Exciting today to learn a lot of new things. I will try to share with you in the next 20 minutes some perspective and some activities that we are doing in the real life related to how to use new technologies to change completely the approach that we have during acute and subacute phase inside the rehabilitation hospital, and how to try to use technologies to facilitate continuum of care that is very important. That means that we have to try to use new technologies to boost connectivity in the system and to boost connectivity able to change the ability of the patient to modulate activity, to control specific function, and to increase the ability to participate, and then to change behavior, not only to change grasp and release. Then we have to look for technologies for care, particularly wearable robotic system and all the neuromodulation system, and technologies for services, because it may be very important to follow the patient using any technological support, to have a support of services to support your decision. And I would like to focus particularly how, using new technologies, we are able to change the dynamics of the network that we have. Because when we have MRI or fMRI related to connectomics, we don't know exactly what happened dynamically during exercise. And then if you look something, focus on how to restore mobility, gait control. Professor Perinou showed us a lot of different possibility to try to interact with the patient. We have a lot of different technologies, and particularly we have these new technologies related to overground training, completely different from Locomat. Overground training to restore gait, as well as we have a lot of different technologies to support training to restore grasping, release, reaching, and so on. And then we have to combine these technologies with conventional treatment too. But in the same time, we have to try to identify the model of learning that we are trying to use when we are using conventional training or any other technological support, moving from implicit learning to explicit learning, and particularly to perceptual learning too, and intensity able to modulate, for example, BDNF release, and using technologies to move from cell to behavior and then to society, to negotiate a common direction of movement, mobility, or any upper limb control. And now when we will start to look technology, I would like that, particularly for posture and gait, we have to mix the problem of cognitive, sensory, perceptual learning, emotional, and the spinal cord to combine this very complex system. Moving from the ability of the patient to control posture, then the balance is a key point. But look this one. This is a typical young stroke patient, hemorrhagic stroke due to malformation in subacute phase, unable to walk, with two physiotherapists that support the patient. And if you look, we put some EMG wireless electrode to detect the movement during gait. This is the conventional treatment. And this is exactly 15 minutes after when the patient wear the robotic system and start the technological training overground with the physiotherapist that on the back control the patient. Then the patient without quadruped, without cane, just to control anterior-posterior displacement. This is a wearable robotic system with power on the hip and on the knee, no power on the ankle, and the rhythmic movement is due to the coordination between patient and robot related to transfer of the weight right and left. Then when the patient move right, you will have left advancement, and when the patient move left, you will have this one. Try to compare EMG. This is the EMG during conventional treatment. And this is a right hemispheric, right hemiparesis. And this is tibialis anterior, soleus, rectus femoris, and flexor of the knee. And this is the left one, red, during conventional treatment. Do you think that this is the best way to restore timing, coordination, to have sensory information to the cortex, and to restore ability of the patient to control movement? And this is exactly the same patient 15 minutes after, during training using wearable robotic system. You change completely the pattern, particularly look tibialis anterior timing, and look the timing of tibialis anterior on the other side. Then you push control on the paretic side, and you reduce compensation on the non-affected side. But we have new technological advancement, and this is exactly from France. This is Atalante, is the first wearable robotic system with power on the ankle too. Not only on the hip, not only on the knee, you have the possibility to control the ankle too. And this is the first one able to support the patient without any support. It's the patient itself that maintains, with the collaboration with the robot, standing and control gait. And this is a typical left hemiparetic patient about 2 months after stroke during standard condition conventional treatment. Okay, is a patient with a very important weakness. And this is the same patient, the same day, during wearable robotic training, without any support. This is just for safety. You don't have any support. And you have a completely different control. And with a system like this one, it's possible to train the patient to move backward. We use around 30% of the session moving backward, because moving backward means that you increase control of the trunk, for example, and you change completely the possibility of the patient to explore the space. And you have the possibility to perform lateral displacement too. And then you, in the same time, 1 hour, you perform exercise forward, backward, lateral, and with different control, because when we use EMG during training, we use EMG to define exactly the fine-tuning of the system in terms of velocity, swing, stance, step length, and so on. Then personalized treatment means fine-tuning of the technologies that you are using to train a patient. And this is the patient the same day, immediately after the session. And if you look the patient reduces spontaneously the lateral displacement during spontaneous gait, increase the cadence, increase velocity too. But particularly the patient change the lateral displacement immediately after. And this is the EMG without any wearable robotic system before and after. Okay, then if you look scientific paper, it's possible to say that using robot, cobot, and maybe non-invasive stimulation, it's possible to increase your ability to restore ability of the patient to control mobility inside and outside the home. But patient would like to move at home, you have new technologies to follow the patient at home too, because you're moving acute, subacute phase with very important wearable robotic system like Exobionics or Atalante. And this is an Honda device to support the patient at home. This device is a device with the power just on the hip, and due to this it's possible to change balance control, step length, velocity, and so on at home. Continuum of care. Or this is another possibility. This is from Switzerland, is Mayo Swiss, is a soft robotic system too, with a specific control hip and knee using a particular design of the system. Then it's possible to move from acute phase to home using different technologies. And telerehabilitation too may be a way to improve the ability to work at home, and this is a review that very recently stressed that it's possible to do this, but limited number of studies, and they focus on walking speed or endurance. We have to decide the outcome measure that we have to use to demonstrate the efficacy of a system. And for example, here we don't use time up and go. Time up and go tests may be very important to look the efficacy of a system like this one, because means change the position, reverse the direction, and change again the position. That is more important than walking velocity or endurance too during daily life, because means that if you improve time up and go test, means that you improve the ability of the patient to decide to move and to change the position in the world. About balance, this is a technological system to control balance in sitting and standing position, but it's possible to perform balance control training at home too. Now you have a lot of different possibilities. This is just one of these, and to monitor the patient at home too. Then technologies for services and technologies to measure the efficacy of our treatment. Up to now we have a lot of different wearable robotic sensors able to detect position, sleep quality, number of steps per day, how many minutes you stay in sitting position or standing position. You have everything. And we have a very nice experience using wristband to detect the number of movements that you perform each day in stroke patient. And if you look, the number of movements per day of the non-affected limb generally is 30% less of the normal subject, even if it's the only upper limb that you're able to use. That means that we have to focus using different outcome measures, not only on the impaired part of the body, but on the non-affected limb, ipsilateral limb. And when you have systems like this one, you have to increase all the communication system between the team and the patient, and to maintain strictly connection even if the patient is far away from your hospital, because we need this wearable system to be able to detect cognition, social cognition, and to detect all the activities related to the complex system of intentional movement, engagement during exercise, and so on. And due to this means that using different technologies, we work particularly on movement representation through different motor activity that we are able to put on the table to support our patient. Then means that we have to focus on function, but particularly we have to focus on behavior. And to focus on behavior in this moment, we need absolutely a technological support to detect the behavior of the patient and to detect the results of our treatment and to support our patient too. Again, you have the typical review and meta-analysis able to say that using this robotic system, you are able to increase the ability of the patient to control during daily life, but we need more and more study to define the efficacy on daily life of our patient, even if now we have bilateral and master and slave new robot that change completely the upper limb rehabilitation, because you will have the non-affected limb that will move, and by this way you will have like a slave that the other one will perform exactly the same. Then by this way you change completely the engagement of the patient on the activities and the intentional movement that the patient try to use during activity. And this is exactly from France too. This is very important. Before to plan, we have to be able to imagine our movement, and using this visual observation technique, we are able to detect the cognitive flexibility of the patient. Because particularly for the upper limb, cognitive flexibility means ability to support your rehabilitation program, the complexity of the rehabilitation program, and to think if you have any predictive data, able to say this will be the best patient, this will be the bad patient. To try to detect bad patient and the best patient, we try to use regularly during exercise sensors, using sensorized t-shirts, now I can show you, able to detect heart rate variability during exercise. And heart rate variability means, it is the only topic that we don't mention, Jamel, the autonomic system. The autonomic system in stroke patient is the ghostwriter of the rehabilitation progress of the patient. Then maybe that focus on autonomic system change our idea how to manage the situation. Why autonomic system? Because starting from heart rate variability, we look at activity on prefrontal cortex and insula 2 are strictly related. And using an automatic analysis of heart rate variability, we are able to detect cognitive flexibility. There are a lot of paper, physiological paper, able to demonstrate this. And this is the sensorized t-shirt, and this is the typical result. Using this sensorized t-shirt and heart rate variability, the pink one is related to vagus. When you have meditation, you have more vagus activity. And the other one is sympathetic reaction. When you have to fight, you increase this kind of power of the potency of heart rate variability. Then during cognitive task, more vagus and less sympathetic, and vice versa. And we are doing this. We follow the patient at rest. During the SNT, imagination, you increase this one. And during this bioextreme exercise is a specific exercise with a very important activity of the patient. Then this is the best patient, that is a patient with cognitive flexibility in different conditions. And this is the bad patient. You don't have any change in different conditions. Then new technologies to define and characterize the patient. And body representation may be very important in terms of recovery of function. This is a work that we perform with the University of Lausanne, and we are able to demonstrate that neuromuscular stimulation of the upper limb in chronic stroke change representation of the body and peripersonal space. And neuromuscular stimulation is a typical stimulation that is possible to start very early and is possible to perform at home too. And telerehabilitation may be very important because the biology of the system now explains that we need time to restore function. Neuroradiologists and neurologists would like to save time, to save brain. We need time to rebuild the brain. We are exactly on the opposite situation. And using virtual reality too, may be possible to improve the possibility to restore peripersonal space and the ability. And now we have a lot of different possibility to use virtual reality. And particularly now there are the last version of the sensor to have immersive virtual reality with the hand completely free. Then very ecological movement without any problem. Then we have to face the near future and now too with disruptive technologies that change completely the organization that we have. Cyber therapy is not a revolution, is something that we are able to perform in the bed, and we are able to use robot to combine typical interaction between the human and the technology. And we have a lot of quality and economical possibility to manage the situation using telehealth. Then telehealth, telerehabilitation will be in the near future mandatory to maintain connected care and to use telecommunication in the right way. This is not true that people after 80 are unable to use technologies. We have no less than 3 trials using new technologies in people very old without any major problem. You have to educate the patient and educate the caregiver, because we would like to have this connection inside the brain, connection between technologies and the patient and the caregiver and the team. Then means that technologies are not a barrier. Technologies are facilitator of communication. We are not looking robot, we are looking cobot. Then collaboration is very, very important. Try to use new sensor to detect movement, but digital health will be the real future that we have to face, to move from reality mining, data mining, to have new outcome measures to demonstrate if this new model of rehabilitation using new disruptive technologies change the quality of life of our patient. And this is really the near future. We don't have now, but biosensors will be able to detect metabolic change of the body or of a muscle, non-invasive evaluation during exercise, during 24-hour monitor of the patient. And you have to think that from 2030, the market of biosensor will move from 20 billion to 40 billion euros around the world. And maybe that in the healthcare too, we will have this revolution and we will have a lot of possibility to monitor our patient. Finally, artificial intelligence. Without artificial intelligence, it's impossible to manage technologies. It's impossible to manage all the data that we have. Then we have to combine artificial intelligence too to change completely how we face the situation that we have, humanizing our relationship with the robot and cobot, particularly cobot, and combining a lot of different technologies on cognitive science, information technology, and biotechnology and nanotechnology to have a new model of organization able to support us that we would like to rewire the brain of our patient using a robot too, but we have to change our idea. This is from France. Then we have to change. I finish. And we have to move from this typical emotional relationship and introducing new technology. We will change our ability to support our patient. Thank you very much for your attention.
As usual, many thanks for your very, very nice talk. Thank you for being here today, Franco. Do you have a question to Franco? Interesting results about the effect of exoskeleton on lateral pulsion, and it's interesting to study this effect
in
our patients.
Sure. This is exactly a typical example how new technologies allow us to do something that conventional treatment is not able to manage in the right way. Because you introduce this collaborative robot able to change the behavior of the patient and the motor control.
No question for Franco? Well, so many thanks, Franco.
Thank you.